My name is Ella Firestone, and this is my clinical reflection video. The purpose of this video is to cover the ways that I met the course objectives through my clinical experiences this fall. Clinical Objective 1 is to apply knowledge from previous courses in the physical and social sciences, humanities, and nursing in meeting the multidimensional needs of individuals and groups within the local geographic area. I met this objective through a lot of my community leadership experiences this semester. Firstly, the blood pressure clinic. I applied knowledges from my health assessment skills in taking blood pressures and understanding the different ranges of hypertension or normal ranges for blood pressures. And then additionally, the flu shot clinic. I used my previous pharmacology skills in injecting IM medications for nurses who came by the clinic to get their vaccinations. And then in my wellness hours, I used my previous knowledges of health and how exercise promotes physical and mental well-being. My other peer leadership clinicals that involved pharmacology tutoring, 309 skills, and 311 skills labs helped me assist the junior students in learning new material, a material that I have previously learned. So then Clinical Objective 2 is apply the basic principles of ethics, management, and leadership to meet the needs of patients and their families. I met this objective firstly in my advanced practice, where I followed the emergency department manager of St. Luke's Carbon County, Marcia Estep. She showed me a lot about what her job involves in managing the floor, the staff, and how the staff are caring for the patients themselves. Then I also followed 2 nurse supervisors within one clinical experience because there was a change of shift. I watched them manage the staffing for all of the units, manage the supplies in all the units. If they needed anything, they were leaders. They were who everyone went to when there was a problem or if they needed something. And then lastly, within my interprofessional clinical, I experienced a couple hours at Holy Family Manor following the CEO. I watched him interact with different business partners. I sat in on some meetings that were about changing the ways that they went about caring for their residents. And it was a really good experience in watching someone be a good leader and a good manager at such a high level. And then number 3 was evaluate the effectiveness of communication in promoting the optimal health of patients and their families. So again, I did this within my advanced practice because there was a lot of communication between the manager to the staff on how they are completing their care and the timing of their care from door to treatment. And it was a very interesting thing to learn about. Additionally, in the nurse supervisor clinical, me and the nurse supervisor were talking with a family whose family member was just put on comfort care and how we could further meet their needs. And since it was a night shift, we went and made a comfort cart for them that included coffee, tea, snacks, sodas, waters, and we told them that if there's anything they could need to reach out to us and we would be able to help them. So just communicating with them really promoted what the patient needed and what their family needed during this difficult time. And then lastly, in the interprofessional clinical again, the CEO of Holy Family Manor, he would talk to all of the staff about what could be done in order to promote the well-being of the patients. We had a meeting with the woman in charge of the laundry for the entire institution. She washes the sheets, the towels, all of the bedding, everything, and she noted that they need different types of laundry detergent that will be better at disinfecting and more cost effective. So the 4th objective is to critically analyze and integrate leadership research findings into the total plan of care for a selected group of patients and their families. So I met this objective during my political leadership experience because I really integrated a lot of research that I did on some bills that I'm going to talk about later in a different objective into the plans of care for patients and how it would affect them. And then secondly, Again, in my advanced practice with Marcia Estep, she really went into the importance of timing for myocardial infarctions that come in, suspected myocardial infarctions, from their door to treatment. St. Luke's, Carbon County, or St. Luke's as a whole, they like to keep that under 60 minutes. And I did some research, and the Journal of the American Heart Association found that shortening the door to bedtime was significantly associated with survival benefits for the patients. Marcia told me that she collects the data from the past month and audits it, creates a sheet of the door to bed timing, and then she posts it for the staff to see so they can see where they're at each month. Next, clinical objective number 5 is to apply the principles of ethics, advocacy, and teaching to the everyday care of patients and their families. I really met this objective during the political experience because I met with Judy Ward's staff. Judy Ward is a state senator for a southern part of Pennsylvania. She was a practicing nurse and still keeps her license with continuing education for over 20 years. And she now is in politics in order to advocate for patients and nurses. So me and her staff covered the Pennsylvania Patient Safety Act, PA House Bill 106 and Senate Bill 240. This was the first time I really learned about the cons to the issue, pros and cons. The obvious pros for staff ratios are to prevent staff burnout and to promote patient safety and care. However, on the other side, you have to consider that if all of the floors have met their quotas, they can't take any more patients, then the ED cannot admit any patients to the floors. So then the ED cannot take any patients in from the waiting room, and then the emergency department waiting room gets backed up. So you really have to think about how the staff ratios would affect the rest of the hospital. And then additionally, we talked about how in her area, healthcare can be hard to come by in a rural area. The closest hospital to some people is an hour away. These hospitals are a lot smaller, have less financial resources, meaning that they might not be able to meet the legal requirements of patient-staff ratios. And this could cause these hospitals to close down. And then patients in these areas, they might not have a hospital close to them until 2 to 3 hours away, meaning that patients who experience strokes and myocardial infarctions will not receive life-saving care that they need within a short amount of time. So I really learned about how these issues in politics relate to ethics and the positive and negatives, and how these policymakers have to really consider both sides when making these decisions. So the number 6 was formulate plans for continued personal leadership growth and development as an independent practitioner of nursing. I met this objective within the political leadership experience. I found it very fascinating. I could see myself maybe doing that one day once I have a lot of nursing experience, going in, advocating for nurses and patients. And then next, within the community leadership experiences, the flu shot clinic and the blood shot clinic specifically, I think I could see myself doing that long term throughout my entire career, going out into the community and providing these services to low-income communities, people that may not have access to care, or just holding clinics for everyday people that do have access, and this is where they choose to come get their shots or blood pressure taken. Next, within the peer leadership experiences, I really enjoyed assisting the junior students in learning and applying new material. I could see myself continuing this growth and development in becoming a professor, going back to school, getting my master's in nursing, and becoming a nurse educator, being a professor or clinical instructor. And then lastly, I met this objective with my continuing education. I went to one of the student nurse associations, Dine and Discuss, where they had a practicing Cedar Crest nurse come in who has been the head of many different ICUs, emergency departments, burn units, She has been a leader all over the board at Lehigh Valley and had just taken a new job with a different healthcare system, doing a new job. Her career for the past decade sounded really, really interesting, and she encouraged us to always say yes when new opportunities are presented to you. She said each time it was scary, but she always said yes, and then she always ended up achieving it and doing way better than she thought she could. So then clinical objective number 7 is to recognize the role of the nurse in policymaking related to healthcare services at local, state, national, global levels. So this was met in the political clinical experience that I'd mentioned before. Meeting with Judy Ward's staff was a really enlightening experience to see how much they consider when making decisions and where a registered nurse stands on these decisions. There was another bill that has been talked about going through to give nurse practitioners the autonomy to practice medicine without being overseen by a doctor. And for a area like hers, a very rural area where there is a shortage of medical professionals, it could be very beneficial to have nurse practitioners be able to provide care without doctors being required around. But then there's the other side of, do all nurse practitioners have the clinical judgment and experience to practice on their own without a doctor, when there are some programs that allow you to become an NP without almost any experience, so they don't develop that clinical judgment that is needed in order to practice without a doctor. And then there are also some areas in Pennsylvania, the big cities, where doctors would say they will be upset by this choice because it'll take patients away from them. Additionally, the lobbyists that we met with then said that doctors should just do better so that they are not losing patients to nurse practitioners. So there's a lot that goes on within recognizing the role of nurses in policymaking, because also while we met with the Republican Health Committee, they have 3 members that are nurses, 1 nurse practitioner, 1 registered nurse, and 1 LPN, who have a lot of great insight to what they bring to light for the Republican senators when making healthcare decisions. And then lastly, number 8 is to predict and describe potential ethical dilemmas within clinical, organizational, and professional nursing practice. So I met this objective during my nurse supervisor clinical. There was a patient who was a young adult and he was autistic, who was physically hurting the staff. He was hitting and scratching. So there was a lot of debate onto whether this patient should be restrained or not, and he was not restrained at all during the time that I was there. So within the ethical principles, autonomy gives the patients the right to make informed decisions about their own medical care, and beneficence is the obligation to act in the best interest of the patients. However, the ANA Code of Ethics, provision 2.1, says that we must foster a culture of safety. And this culture environment was not safe for the nurses, which in the end does not benefit the patients. I did some research on this, and the Journal of Autism and Spectrum Disorders did a study on physician perspectives on severe behavior and restraint use in hospital settings for patients with autism, and they deem that the use of restraints for patients with autism to be ethical. However, with all ethical issues, there are 2 sides. There can be dualisms in all of the provisions and ethical principles that are important to consider. The first nurse supervisor that I was with was the one who decided the patient should not be placed in restraints because he believed it would make the situation worse. However, the second nurse supervisor I was with said that that patient would have been restrained, or at the very least, the staff would have been removed from the room because they should not be getting hurt while working. So those are the 8 objectives, and those are how I met them through my clinical experiences. I really enjoyed these clinicals over the past semester. Thank you for watching.